Good day, and welcome to today's webinar, Wellbeing Resources for Residents Around the World, hosted by the International Relations Committee. My name is Jessie Romance, and I am the Committee Administrator for the IRC. Before we get started, I wanted to inform everyone that this webinar will be recorded and will be available for viewing on the ACS YouTube page after the webinar. Additionally, if you have any questions during this webinar, you may submit them through the Q&A box at the bottom of your screen, as there will be a Q&A portion at the end of the webinar. With that, I'm pleased to introduce you to today's webinar moderator, Dr. Madhushiri Zope. Dr. Zope is a general surgery resident at the University of Alabama at Birmingham and the current IRC RAS liaison. Her research interests include global surgery, telehealth, implementation science, and information management systems in low-resource settings. She is currently serving as a Fogarty Global Health Fellow in Malawi. Dr. Zope hopes to work with the IRC to build inclusivity for international surgical trainees within academic surgery. With that, I'll now turn it over to you, Dr. Zope. Dr. Zope?
Thank you for that introduction, Jessie. I'll go ahead and introduce our first panelist. So I'd like to welcome Dr. Pasant Abdelrahman. Dr. Abdelrahman is an ophthalmology resident based in Egypt, and she specializes in retinal surgeries. She's the RAS liaison for the Ophthalmology Surgery Advisory Council and the Egypt chapter. She's also an active member of the RAS Global Surgery Committee, where she works on coordinating webinars related to global surgery. She has completed a master's degree in global health with interests in leadership, vulnerability, healthcare access, and equity, as well as mental health. Next, I will now welcome Dr. Mateo Gonzalez. Dr. Gonzalez is a PGY2 resident of general surgery at Hospital Vicente Corral Moscoso in Cuenca, Ecuador. He graduated from Universidad del Azuay Medical School in 2020. Dr. Gonzalez loves learning and working at this phase of his career to become an exceptional surgeon. He's always focused on excellence in his work and the care of his patients. Through the long hours in the operating room and studying overnight, he knows he's on the right path towards his dream of becoming an exceptional surgeon. And lastly, I'd like to welcome Dr. Madhuri Nagaraj. Dr. Nagaraj is the Chief General Surgery Resident at the University of Texas Southwestern. After graduation, she is pursuing a fellowship in trauma critical care at the University of Colorado for the next 2 years. She's involved in education primarily through the ACS Resident Associate Society and the Association for Surgical Education. Outside of work, she enjoys reading, movies, spending time outdoors, and eating. And with that, I'll go ahead and begin our moderated discussion. So our first question to our panelists is a pretty broad one, but just to get things started, how would each of you define wellness? Dr. Nagaraj, you can take it away.
Thank you for that introduction and having me here today. I think wellness is a very broad term, as you mentioned, and it is very personal. Overall, I think it describes a state of being where you are happy, you are comfortable, and you are content with life. But I do believe that all of those circumstances are very individual and what that means to each person and what they seek out in life.
Absolutely. Speaking of individuality and how that kind of differs, not only from person to person, Dr. Abdelrahman, would you like to chime in about what wellness means to you, and if you have any contextual clues on how it sets within your contextual setting?
Well, thank you for having me today. It's amazing to be here today with you and Madhuri and Mateo. Well, I think wellness is more about how well you probably look. Like obviously, just from the outside, you look well, you're physically well. But I think well-being is a much more broad state of just being well mentally, physically, socially, financially, vocationally. I think well-being, even spiritually, how well you are. So I think well-being is a more broad term.
And then lastly, Mateo, if you wanted to chime in.
Okay, first of all, thank you for the introduction. And okay, I can define wellness as the act of practicing habits, healthy habits on a daily basis to achieve better physical and mental health. So you can do things that you can be comfortable and you can do to make birthdays for you, not forgetting your principal work at the hospital.
Yeah, I'm actually glad you all took that approach because it sounds like, despite being from very different backgrounds, wellness and well-being does have some like underlying tones of similarity that we can all relate to as surgery residents. Do you think there are any like specific aspects of being well during surgery residency that each of you could possibly speak to, anecdotally or otherwise? Passant, if you wanted to comment.
Well, I think peer support is very important. Like, I think it's very important to learn how to start conversations with your colleagues. I think social gatherings are very important. Just like Mateo said, birthday parties should never be underestimated. Social gatherings, celebrations, celebrating your achievements is very important. I think this should happen like through formal committees in every single residency program. I think this is very important. I do know that in the US, there are formal committees like well-being committees. So that is very important to kind of like be normalized somehow. I think ergonomics in the workplace, in the surgical environment, is very underestimated. I think your physical well-being is very important, especially with the years. I think ergonomics is a very important topic that has to be addressed.
I'm glad you brought up ergonomics because I feel like that's not something that people conventionally think of when they think of wellness, but especially for surgery residents and then faculty beyond that. I think this aspect of being cognizant of how we posture ourselves in the OR and how we take care of ourselves physically is very much correlated with our like longitudinal career. So that's a very important point that you've brought up there. Mateo, Madhuri, any comments about wellness and surgery residency specifically?
We have to talk about, I think, general surgery programs are completely different to the other programs. So we all of us know that we have a lot of hours that we have to complete at the hospital. So we have to take time to breathe, to think what we can do to have that well-being in our life. So I think it's a very important time. Ergonomics, we have to take a time to interact with other people, with friends, with partners at the programs. So taking a little part of time during your shift, sorry, for interact, have conversations, maybe have a meal, coffee. I think is very important in daily programs at the hospital.
I think
And I also think that, oh my God, sorry for interrupting.
Both of them touched on really important things, and that there are many different aspects to wellness and well-being. And some of them are superficial isn't the right word, but some of them are more obvious, like sleep and relationships with other people. And there are things that are more subtle, such as ergonomics, pain, or things like managing with stressful incidents at the hospital, dealing with bad patient outcomes, things that aren't discussed as frequently and are just as important, even financial independence, things that are taken for granted that we don't talk about as much. All of these are very important, and I think each one is reflective of a different person, a different culture, different institution, what's available and what is not. But all of these are also important in supporting the others. So I think being very well requires being well in many aspects, not just one. And so you may be very happy with your exercise regimen, but if you're not sleeping or seeing your family or friends, you won't feel that contentment overall, or that contentment at work, for example.
Yeah, I think between all three of you, you brought up excellent points about how diverse wellness can be. And it's kind of a good segue into the next question, which is essentially, what resources does your program have for wellness and to facilitate kind of some of those topics that we've talked about? And we can start with Mateo, if you want to go first.
Okay, so unfortunately, at my hospital, and we don't have any specific people on a specific department which is working on wellness and well-being of his residents. So it's a very difficult aspect for us, because we have to create or spaces to have the wellness or well-being. So I think very low resources for us for mental health. So we have to think about it. So because we are not preventing health mental we are not preventing mental diseases. So we are just treating or waiting until some resident have a mental disease or a mental problem. So that's not good. So we have to create our own spaces for have well-being resident.
And then Madhuri, if you would like to comment on your setting.
Absolutely. And I know we talked about this in our practice session, but I feel very strongly about this, particularly because I feel that COVID affected everyone in the country. And I hate to bring that up, but I do think that there was a big cultural shift in wellness after recognizing the burnout after COVID. And fortunately, in the United States, there was a big push for those wellness committees that Passant mentioned earlier. And these committees are, whether they're institution specific, organization specific, their goal is to improve wellness, the practice of well-being. I am also at a very large institution, so I'm fortunate to have a lot of those resources here. And the distinction I would like to make are things that I think are helpful versus things that are very durable and long acting. And so things that are very helpful, I think, are social hours, happy hours, events with our faculty outside of work, where you get to know your colleagues outside of the work environment, outside of scrubs, in a setting where you can bond a lot more closely. Things like that, making sure our work hours are as reasonable as possible and that we have a sick float system, for example. It's not perfect, but if people have illness or an emergency, there is some forms of coverage and more of a push to seek out coverage as opposed to pushing through, which I think was the nature of what we did before. Things that I think are incredibly durable and not spoken about as frequently are resources to, for example, the mental health and wellness center at our institution where residents and students have much more affordable, fundable access to psychiatrists and psychologists for time. While the hours are still being worked on, I think this is a resource that is well utilized at our institution, but could still be more utilized. And access, like I said, for sick float or pushing for various resources across the Rouse ACS, such as access to meditation spaces, easier access to health and exercise programs, things that really build those core concepts of wellness we were talking about. The one thing I'd see or like to see going forward are that a lot of these are available to some extent, not universally, but very individual. Whereas I think people who are genuinely suffering really need support from their colleagues or need to be sought out. And so finding ways to make this a little bit more accepted and universal, and our interactions with others more intentional as opposed to your individual access to resources.
And then Passant, if you want to comment on your institution.
Yeah, sure. Well, as I said, at my institution, we have those like friendly social gatherings. We also have what is known as a YO club. YO stands for Young Ophthalmologist. We have a YO club which supports the young ophthalmologists at my institution. We don't have a formal committee, like I said, but we have an administration that really listens well to the residents. We have a lot of mentor support. And I also want to point out that we have an authority which assesses the quality of institutions, healthcare facilities at large. It is called the General Authority for Healthcare Accreditation and Regulation, which is its abbreviation is the GOHAR, and it in the introduction section it does address the importance and highlights the importance of physician well-being. And in the handbook of the quality standards, it really emphasizes on the importance of on the fact that the patients are not the only consumers of healthcare systems. Physicians are very important, and their well-being will affect the well-being of the patients somehow. So to kind of it is not only about the recruitment of physicians, but it is also about the retention of physicians, which is very important. So I think this really strong emphasis does make institutions really care for the well-being of its staff.
Having heard all that as a surgery resident originally from the US as well, I wanted to ask Matteo, do you think in terms of all of these resources that we've talked about at like an institution where wellness has become the norm, are any of these potentially translatable to where you work? Do you think there is momentum or interest to kind of integrate these?
So we are the first people. We have the obligation to demand to the institution committee of well-being residents. So I think it's a very good moment to demand the institution committee of well-being, because it's not always to take care of all the patients, just focus on the work, on the hours. So we have to take care of us. I think the first thing we have to take care of us, to to give a good care of the patients. So as I said, we are the first people to demand the well-being to our institutions. So I think it's a good moment to work in that aspect.
Yeah, that's very impressive, and I applaud your willingness to be the first to kind of pave that way, because I know you had talked about having to make your own space almost to be able to talk about these things, even with your faculty and your coworkers and the academic program as a whole. So you not only have to bear the burden of practicing wellness yourself, but you also have to be kind of the forerunner of like paving that way for everybody else who comes after you. And that's a whole different like level of bringing wellness to surgery residency that frankly I haven't had to experience as a resident in the US. Passant, I was going to ask you, do you think there are any like takeaways from the US institutions that you've heard about from Madhuri or I that would be well adopted to your situation, or do you foresee any like potential barriers to kind of making that translation?
Well, if I was asked this question like a few years before now, I would say that yes, there are to some extent a lot of cultural barriers. Stigma is real, but now I'm talking like on a macro level, like on a country level. In Egypt, mental health is you see a lot of mental health campaigns, um, gender equality, gender equity campaigns. Speaking of female surgeons, um, so yes, there are some cultural barriers. Uh, let's be true about this. Um, and I think yes, physicians kind of tend to shy away from disclosing mental issues that they might be facing, burnout. I think people might feel that this kind of limits their surgical opportunities and chances if they disclose that they um, do feel, or that might make them seem more fragile than their colleagues. So yes, I think people might be shying away from, speaking about their mental issues um, and hardships. So I think to some extent, yes, there is still some kind of cultural barrier. Uh, so I think this is like the biggest barrier.
Yeah, definitely. And as you said, well-being, I think overall kind of falls into this umbrella of mental health, which is, as you have suggested, very culturally different in terms of perception and how it's treated and how it's accepted. I wanted to ask Madhuri, um, have you, in your experience throughout your surgical training, ever seen any barriers similar to that stateside, or are there like different ones that we see that haven't popped up yet in either Ecuador or Egypt that you've heard about?
I want to say yes, and thinking through all of this, there are barriers. I'm very understanding and respective that I think our barriers are much less and have been addressed way earlier, I guess, and more frequently than what I've heard Mateo specifically speak to. Things that I think I would just mention, maybe not necessarily specific to us, but generally is, as Passant said, we talk about wellness and well-being, but I think there is still that step over the line of honesty and true sharing that doesn't exist. And so, as I mentioned earlier, I think a lot of these resources are there or are available or can be made, but the onus is really put on the individual to seek out these resources. As Mateo said, you have to demand these resources. Whereas what I have found just in my own personal practice and well-being, some of the practices where I had accountability, where I had colleagues or friends or partners, peers who were going through similar things or wanted to share that experience of well-being, discuss what we were going through. That accountability was what was the most impactful for me. And I think that barrier exists not just here, but everywhere. And I think this panel, this is one of the steps to really break through those final barriers. And it requires a lot of vulnerability for anybody across the world. Mentors who are willing to share that with their mentees, us, and other institutions who are willing to take that last step. But I do think that still exists.
I was going to go off of that and actually ask, on the flip side of barriers, I know you had mentioned how COVID served as kind of like a catalyst and almost a facilitator in our setting to kind of jumpstart this movement of universal, almost requirements for wellness within surgery residency programs. Are there any like more ground specific or peer specific facilitators that you've noticed within our culture that have kind of driven this change as well?
Personally, I think, as Matteo mentioned, that demand, that ask was the early part. And I think people realized a lot of things that we needed, such as sleep, such as exercise, were the kind of bare minimum we were asking for. And while barriers exist, I think a lot of the most impactful things I've noticed really don't require too many resources. It just requires that movement and that pure intentionality. And so, for example, even as simple as our residency social group, rather than going to a happy hour, we had a gym class, which is a very interesting thought. And my first initial assumption was, I don't want to see them watch me work out, my colleagues. But it was very fun and very liberating to take that drive that you use at work and instead put it in an environment where you could all work together to be stronger and better at wellness. And so utilizing that same intentionality with your peers to then approach things that are needed. So meditation, for example, in a peer setting, or exercise in a peer setting, things that bring joy, bring wellness, but also address those underlying needs that we have.
Matteo, I wanted to ask, in your journey to kind of create this first ask and create space for you and your peers, have you noticed any things that have kind of helped you springboard that initiative, similar to like facilitators at the ground level?
As I said, I think the first barrier for us is time. The other barriers are, I think, we are our own barriers, because the most of the time we're focused on hospital, on patients, on working hours. So we are forgetting our mental health. So I think we can talk with our institutions, we can talk with our staff to make consensus of the well-being. So I think it's a very important thing to demand that space, to demand those times that we can share just minutes with our partners, with our staff, to have a space to read, to take part the hospital working. So we have to talk. We have to talk and demand this space and this time.
Yeah, I was actually just curious, does Ecuador have kind of a resident, like a surgery resident association to where you can organize these demands across institutions, or are you kind of truly just working one by one to create something like that?
We have a little society of residents, but we are not taking time to discuss about mental health. I think we are focused in other aspects that we think are more important in this moment, but um, it's very difficult because I think it's a very common problem here in Latin America, because we are not thinking in mental health. We are thinking in other things like um, the financial aspects for us, to having some time to make some money to have a good lifestyle, to have a space to support our families, and that's a problem. So we are taking away the mental health and focus on other things that we think is more important at this moment. So we have to talk about mental health right now.
Yeah. Yeah, it's definitely, I think it feeds back into that point of you're essentially your own advocate, and being a surgery resident, you don't have much time to be your own advocate on top of being just technically learning how to do things, learning how to operate on your own, and graduating to the next level. And that kind of mindset, like you said, becomes our own limitation in trying to be like well throughout residency. Um, and then going off of that, trying to find a parallel, I guess in Egypt, Passant, do you have a similar like resident association that will organize and advocate for you, or do you think you're more speaking at an individual level or within institutions? What is your take?
Well, we don't have a formal resident society, medical society, uh, but in many surgical societies, you do find YO committees, young ophthalmologist committees. So I think, but these are informal, like they're not like formal um, societies in that sense.
Yeah, and again, similar themes of having to kind of do it, or seemingly almost do it all on your own instead of having some sort of organizational structure to at least alleviate some of those administrative tasks that come with, coming up with a demand and making proposals of how to fix those things. All right, I guess segueing off of that, what advice do you have for residents who don't have these resources? We talked a lot about barriers and facilitators, and I think we're all at different phases of where wellness stands in our institutions. So the advice that you would be giving is pretty tailored to that phase of development. So I guess, Mateo, we can start with you. What advice would you have for a resident who doesn't have any of these resources? Like, how would you recommend getting started?
I think independently of your working hours, of your hard work you're doing, I think we have to enjoy our program, because I think that's my case. I love doing what I'm doing. I love general surgery program. So enjoying it's very important because you can forget other problems during your work. So and another advice that I can give you to the residents, it's taking time to make some or do some exercise. I think exercise is a very important aspect in our life. So for me, it's a very important aspect. So exercise for me it's very important. So exercise, enjoying your program, I think it's the most important thing here in well-being.
Yeah, I agree. This concept of despite how rigorous our training is, having this mindset of mindfulness and kind of recentering yourself as to why you're doing the work that you are and the progress that you've made as an individual is pretty important and quite frankly, easy to lose sight of when you're in the thick of it and trying to manage multiple things at once. But yes, I feel like at the very beginning, when you're starting off within yourself and then projecting outwards is definitely a good approach to take. And then Passant, passing it on over to you, what advice would you have for residents that don't have access to these resources?
Well, definitely advocacy. I mean, you have to go for advocacy. Um, and if it is not available for you on a national level, you could always join international societies like ACS, for example. You would find the resident and associate society. You could network with uh, with surgeons from different parts of the world. You will get access to well-being resources. These are very common in international societies. Um, and yes, there are well-being programs, well-being committees in those societies. Um, and I think, yes, you could make use of this, and you could always reach out to these societies if you don't have these resources available for you on a national level at your own programs.
Yeah, that's also a very good point. We often tend to, again, focus into our own little micro ecosystem and not really think about resources that are available across borders, which thankfully to advances in video conferencing and Zoom, it's a lot easier to get a hold of contacts across organizations. So yes, definitely reaching out to international societies, partner associations, all of that, and kind of using that as a springboard to build on advocacy and figuring out how to build these resources in your own country is definitely a way to go. And then lastly, Madhuri, what advice would you have for residents seeking out to build these programs?
I would say that you can't know the answer unless you ask. And the worst case, the answer is no. Taking what Passant said, I think the next level is advocate for yourself. When we were kids, we would ask for anything without even a thought as to the answers. And as we grow and age as adults and get into medicine and specifically a surgical world, there's this fear inside of us to ask for help or to ask for resources. And what I've learned over time is not only is the hardest answer no, which is genuinely not that bad, but most people are receptive. If it's as simple as I need to take 15 minutes to hop on this doctor's visit, or I need someone to cover this case because I need to go visit an ill family member. And these are all just examples that have happened to me or friends. Most people are very receptive as long as these requests are reasonable and you advocate for yourself. That is what has been the most impactful for me. And I think that's something easy to do on an individual level. Easy being relative, of course. That's that fear, that bump that we need to get over.
That was really well said. I appreciate you for tying in that aspect of starting individually and then combining that with advocacy internationally and then back to yourself as well in your own day-to-day work setting. That was a really enlightening discussion. I frankly haven't had much insight into conceptions of wellness across borders. Despite having worked in a low resource setting myself during this year, I can kind of speak to what I see as a third party. And it's similar to Mateo's situation where we don't really have designated resident associations or resources for wellness here. But overall, having everybody here as panelists in one session and hearing the discussion back and forth and bouncing ideas off of each other has been really helpful. With that said, I will say we have our first question from the audience. This one is actually directed for Mateo. So this is Ricardo Perez. He's a medical student at your university, I believe. He says, good afternoon to all the panelists, especially Mateo. He studied at the same university. It's incredible to see the UDA students in these spaces in the American College of Surgeons. His question to you is, what is your perspective of mental health on medical students in Ecuador, specifically for your university?
I think University of Azuay has a lot of people, a lot of residents around the world, especially at the USA. So we are trying to apply some aspects of the USA universities. So we are taking a lot of spaces, I think, at the Universidad de la Azuay to take the importance we need to take for mental health. So I think it's a hard work. It's gonna take a long time to have the very important um, aspects of mental health. So we have to work, we have to take the importance of well-being to make programs or make committees to to combat the stress, to combat the burnouts, to prevent mental health diseases. So it's gonna take a time, but we are working on that, and so that's my response to Dr. Perez.
Yes, and I think Madhuri unmuted if you wanted to chime in.
Yeah. Something that I wanted to mention to Dr. Perez and everybody listening is I've also noticed this push for wellness and well-being. It really does start from the bottom up in many ways. At least in the United States, I notice a lot of efforts directed towards students, residents, fellows. And something I've noticed over the years, and I don't know if Madhusha, you want to comment on this as well, is I don't see a lot of those resources translate as you grow into faculty, junior faculty, and seniors. I do believe that those relationships amongst your colleagues may grow and help provide some of those bonds, but a lot of those dedicated resources don't. And I think the importance of medical students now and residents now is to make sure that we build these to last throughout our careers.
Yeah, I can definitely echo that. I think going through medical school and then transitioning into residency kind of around that same COVID era, I've seen a lot of advertising and advocacy for wellness resources in the States directed at not only medical students, but also surgery residents. Again, speaking from my limited experience as a surgery resident here in the States. But like Madhuri said, I don't see that um, longitudinally as explicitly as I do for resident resources. For example, we'll constantly get emails and newsletters from the department as well as our faculty reminding us that there's like a wellness activity going on or there's this new initiative that you can sign up for. But I've seldom heard that conversation between faculty and like a fellow, for example, or just between faculty themselves. It's usually faculty that are just attending resident events to kind of get their own little wellness event in. And yes, I agree. As we kind of ride this momentum and this wave of moving towards a generally more well culture of being in surgery, I think we're going to have to be the ones to kind of carry that torch longitudinally for ourselves and then make sure that it persists for any mentees that come after. Yeah, it's a very complicated and longitudinal goal that we're trying to achieve here. All right, another question. This one's a little bit more specific into any panelists. How do each of you personally combat stress, like a stressful day on the wards or a stressful day in the OR? We can start with Passant.
I would go for exercise as well, just like Mateo said. Exercise is very important for me, and it does help. It does combat burnout, definitely. Yes, it is okay to take some time off. Whenever you really need it. I honestly talk to my mentors whenever I kind of feel that, yes, some days are really hard in the OR and during the residency program. So I think talking to your mentors really help. Um, yes, talking to my peers, to my colleagues, and definitely my family, the support of my family, it does get you through. So yes, I think these conversations really help a lot.
And then Mateo, would you like to comment on some of your own personal tactics?
I'm always trying to enjoying time with family. Trying to have a good quality time with my family. I think other important aspect is partners in our programs are like our families, because we are spending a lot of times with our partners. So sharing time with those people, taking time to share with that, making some conversation, sharing a coffee, sharing a meal. I think it's a very good strategy to combat stress. And as I said before, exercise for me, it's a very good um, aspect to combat stress.
And if I could add to that, I completely agree with exercise. I completely agree with family, friends. I also have a personal rule. If I didn't hurt someone or nothing went terribly wrong, I give myself like 5 minutes to worry about it, think about what I could do better, and then let go. And I tell this to my interns too and my junior residents. And I think that's one thing that I do that also relieves my own stress, is telling others when I have been in similar positions or made similar mistakes. For example, when you're in that moment, it seems huge. And when you hear from someone else that it's not so bad, it kind of relieves and offloads some of that. And sometimes, like Passant said, just take some time away. Those stressors that really are stressful will stay, but many of those will dissipate. And you will then recognize what are the ones you need to address and what are the ones that really were just emotional or heavy in the moment, and will leave with some time.
I'm going to add on to that as well. Exercise, definitely, yes. But for those of us that have a difficult time of getting into regular exercise, personally, I'm going to say I really look to spending quality time with peers. And the main medium through which I tend to do that is usually like stress cooking for people and like hosting dinner parties, or just like bringing food for people that have been eating like pizza for a week straight. And that's definitely something that I have definitely like brought on from my parents' generation. But it kind of gives me a second outlet and almost a break from the surgery world to kind of think about this like different aspect of my life, food, which is like so crucial, but also something that we tend to skip a lot as surgery residents, and kind of minimize the importance of like eating well in general. So yeah, food and like time with family over dinners and time with friends over dinners is something that you kind of have to intentionally carve out time for, but is definitely a huge stress reliever.
And one thing I'd add to that, I think it's your cooking, but hobbies. I, at some point in my residency training, totally forgot my hobbies or that I had a life before medicine. And in many ways, once I reconnected with those, it actually made my work more meaningful, and I connected with my patients over very similar things. And so taking some of that time to cook, or taking some of that time to read or do art, for example, I like those things. It takes your mind off for a period of time and brings that joy for when you first started.
Yeah, and I think that kind of wraps back to Mateo, what you were saying in the beginning about just enjoying your time, not only as a resident and like in the OR and in the wards, but as like a human being in general, just like going through life at whatever phase you're at, and taking the time to really think and like be present for those moments in which you're spending with family. We're kind of running up into our last few minutes here. So I'm going to go ahead and ask one final question, and then we can do a round of final comments along with the response to the question to end the webinar. This one is more going back to kind of Passant, you were talking about how one of your biggest stress relievers is talking with your peers and talking with your mentors to kind of find the similarities of their experiences and essentially just share the burden, if you will. Outside of like your peers, do you think you have a good support system within your like designated mentors in your program to have that like frank discussion with?
Yes, yes. I think they are a very good support system. But yes, I definitely would have appreciated it more if we had like a formal committee, just like I said. I also think that one of the very important things that are lacking in so many residency programs um, is helplines. I think, yes, you should kind of have like helplines made available where you could like call anonymously if you don't want to share your identity or disclose who you are. I think this does make it a bit easier. So I think helplines would really help. I just felt the urge to say this.
Yeah, of course. I mean, in the States, we have helplines for civilians. So I think having one for residents specifically would be very appropriate in terms of being able to feel comfortable reaching out to that service in anonymity and like seeking out true help. And then Mateo, I wanted to get your thoughts as well. What do you think in terms of like having these discussions with peers and faculty? Are you comfortable doing that? Do you think that's a potential source of helping you be well throughout residency?
I think peers and faculties are a very important team, and they are, I think that they are our own personal supporting system for well-being. So having a good relationship with faculties and peers are very important for us. Unfortunately, as I said before, in my institution, we don't have a specific system to support well-being of the residents. So we have to work in that because institutions have to give us a space for that, support for that. So until we have that systems, we have to try by our own to combat the stress, to have well-being with our faculties, with our peers. So we have to, as I said before, we have to demand to our institutions, to our countries, to our cities, the well-being. So let's work.
And then Madhuri, if you would like to close us out on that same question of honesty that you had brought up before.
The closing makes me nervous, but I think, as I mentioned, I have noticed, and others can speak to this too, but that gets easier with time. I think when you first start as an intern or junior in the world of medicine, you have peers who are going through the same experience, but everything is new. And as you grow through residency and time in this field, pretty quickly you start to develop this relationship with your faculty and your peers that's much more family and much more closely related. That hierarchy starts to disappear. And I see it not just in myself, but in a lot of my faculty too, who to this day will run something by a colleague or call someone in. And I think as long as we lean into that and that ability to reach on each other and not care, oh, how many years of practice have you had? Or maybe I've seen something more often than you have, and realize that all of our experiences are unique, but many are similar and many are shared, that you can lean on each other for those. And it gets easier, I think, with time. And that's been my own personal experience. I won't say that I'm this way with everybody, but I've noticed I got closer to a lot of my faculty with time, and even a select few who have become close mentors and friends throughout my time here. And that is a subtle change, but when you look back, you realize how different that feels from when you first started.
Yeah, and definitely building off of that, I wanted to give another shout out to Mateo. I think even though you are truly at the beginning stages of kind of creating the space and bringing about the conversation, you are starting to gain your own experience as a surgery resident. And with that seniority, it's starting to make you more comfortable demanding these things, essentially. And the reason I say that is because we had one of your medical students come on and listen and ask you a question. So it shows that as we grow older as residents, we have our own impact on the future generations of surgery residents that are coming in and shaping how heard they feel in terms of as trainees going through a rigorous program and wanting to demand wellness. So to kind of tie it all together, yes, definitely, it's very difficult to start out, but I think amongst our panelists, we're all kind of relatively green, some of us more so than others. And I'm hoping that as we go through our years of training, we can kind of continue to keep these discussions in mind and keep on building for future generations to come. But yeah, that's those were my final comments. If anyone else wants to add before I hand it over to Jesse, feel free. All right. Well, thanks. Oh, sorry, Madhuri, were you going to say something?
I was just going to say, I think first and foremost, the fact that this is happening is a great start. And I'm really grateful to be a part of this and to hear it being talked about. And that recognition that we should pay it forward and that we're all human, whether it's your faculty, your medical student, someone you met in the hospital, recognizing that we're all going through things, and paying that kindness and well-being forward to others often brings it back to yourself.
Definitely. Well, thank you all for joining. Thank you all for the very enlightening discussion. I'm going to hand it over to Jesse.
Thank you so much, Dr. Zope. And I echo your sentiments in thank you and appreciation for those who were able to join us for today's webinar, as well as for yourself and the panelists for taking some time to, as you guys said, share your knowledge and bring these resources to the forefront. As I mentioned at the beginning of the webinar, this webinar is recorded and will be posted on the ACS YouTube page, along with other past webinars on the American College of Surgeons YouTube page under the Global Surgery playlist. And if you are interested in obtaining more well-being resources, please visit our Surgeon Wellbeing section and program on the American College of Surgeons website. Information on that website, as well as who to contact regarding surgeon well-being, is on the screen. And since this is a resident webinar, I would be remiss to not plug and remind that this year, residents can become members of the American College of Surgeons for free. And when you become a member, you will automatically join RAS, which is our Resident and Associate Fellow Society. And lastly, if you have any questions about this webinar or any feedback, please contact me or any of the other IRC staff. This information is on the screen. Once again, thank you all so much for joining us today. We hope you have a great day. All right. Bye-bye, everyone.
Bye. Thank you.